Today, we're excited to go ahead and highlight one of our community members. There's so many different areas of innovation happening in the sports world. Some of them are more forward-facing than others. I'm so excited to go ahead and bring in our good friend Kelly Morgan at Elite 7 Sports Medicine to really start to educate us on what is going on the rehabilitation side, on the athletic training side, to make sure that our athletes are staying healthy. So it's not my story to tell. So Kelly Morgan, welcome to the screen. How are you doing today?
Thanks. I'm doing great. Thanks so much for having me on and giving us a chance to kind of educate about this topic, because I think it's something most people don't know very much about.
You hit the nail on the head. And as a former athlete, and I was a punter, so I spent a lot of time in the athletic training room. So I think I'm more familiar than most. But Kelly, I always like to understand the origin of, how you got here, how you identified, that there was this gap in the market. And then, we'll start to build and educate around what's going on, how it's currently, addressed. And then we'll start to connect some of the dots on what you guys are doing at Elite 7, through this conversation. Yeah. So let's go back to the beginning. Give us a little insight to your origin story.
First, so my origin story is kind of a unique one. I actually, like most people, started off as an athlete, competed through college, did more of the club sports as opposed to intercollegiate, but had a great career, knee surgeries later. I think a lot of us have that same story. And so I've seen both kind of the athlete side and then what happens on the injury and rehabilitation side. So I did athletic training, exercise science as an undergraduate major in college, worked in that scene, did that overseas for a year, and then went to medical school. Because I wanted to be the boss. Go figure, right? I think a lot of us can identify with that as well. And so ended up kind of, meandering and figuring out how did my interest in athletics and interest in medicine kind of coalesce, and how could I figure out what I wanted to do? So obviously most people go into orthopedics. I didn't do that. I went into emergency medicine because I wanted to be able to deal with anything that happened anywhere. And that's kind of, the jack of all trades is what emergency medicine does. And, it kind of meandered in. I was a Taekwondo athlete. I was a gymnast for years. And I ended up working with a company that was kind of covering USA Taekwondo. And so we would go and we would work events. And honestly, I worked my first event. Like, I competed and then I fought and then I worked the rest of the event, because that's just what you do. And I started to kind of get a lot of experience in the event medicine space. And what we were learning and what we were seeing was that, we would see athletes at an event, and then we'd see them a couple months later because we had this great multidisciplinary team that traveled. And what we were finding is that people weren't getting the care that they needed. And so we would see somebody, they'd get a concussion, they'd have a second degree MCL sprain, name your injury. But then what would happen is that it would be a delay in getting into care at home. They wouldn't get care that understood the sport. There'd be continued delays in training. And then by the time we would see them 2-3 months later at the next event, they hadn't gotten a ton better, and they hadn't gotten what they needed, because the people that they were seeing didn't understand what the needs of the sport were. So we started to kind of figure out that, athletic training typically has been in the scholastic and the collegiate and the professional environments, but man, we're missing the mark a lot on like what's happening in travel sports and in all these, with all these athletes that don't have access to an athletic trainer or any type of like system of care in place. And so that's kind of where Elite 7 was born. As we said, there's plenty of people working in the event medicine space, but nobody's doing the continuum. Nobody's figuring out the follow-up, and we're not getting people what they need. So that's where we came up with it.
How cool. And I think one of the coolest things in sitting on this side of the screen, is it's always neat when you have innovation that is bred from a lived experience, right? And so, as sports as an asset class continues to grow and scale, there's a lot of unique perspectives that are coming in. But I always think there's something so valuable, like with the Taekwondo example, right? So now it's like I was playing and then I went right into it. So firsthand, right, where the challenges are, right? So, so let's just go ahead and level set for everybody that might not be familiar with Elite 7. What exactly have you guys built over there?
So company was founded, actually it'll be 2 years like next week, which is pretty cool. And and what we did was we said, okay, let's make sure that we're providing in-person services, because that's what everybody knows athletic training to be. And then what we said is like, what we would like to do is be able to have people be able to follow up with us virtually. COVID kind of borne out, what we now know is a massive rise in telehealth. And it's a space that athletic trainers really haven't, for the most part, been in at all. And so there's this huge opportunity in front of us to take what happens on the in-person side. So say we're working a Taekwondo event, a soccer tournament, whatever. And you think about it, a lot of people travel. You would love to be able to see the same person who saw you if you had a good rapport with that person, right? You don't want
Sure.
to tell your story 50 times to a different person every time you go into a new office or see a new provider. That's a pain in the butt and everybody knows it. So you lose time when you have to continue to re-explain yourself. So what we did is we started doing in-person services and offering virtual follow-up to be able to continue the care that we started when we saw you at the event. Now, it doesn't have to start in person. It can start virtually if you need. And then what we did was develop a very low-cost subscription service to basically help power an electronic health record that we're building. Because typically your athlete health data is segmented and siloed between whichever healthcare providers you're seeing. So if you're seeing it in ER in one hospital system, you follow up with, your primary care provider, orthopedist, they're in a different system. A lot of times those systems don't talk. And despite the interoperability that they try to get with these health information exchanges and stuff, not every state is created equal when it comes to that. And so there's huge gaps in being able to translate knowledge and what happened in one place to then what happens in the next place. And there's just no communication.
Interesting. And I think that a lot of both athletes can shake their heads and more importantly, parents can shake their heads, right? Where it's, you're trying to put your best foot forward and provide the best experience for your son or daughter or for you as a participant. But when you have those silos and those fractions, it makes it challenging. Kelly, talk to me, you talk a little about the Olympics, right? And, these NGOs, and then they sort of break down into state organizations, and then you have this private layer underneath. Are you guys working from the top down to sort of set this protocol, or how are you guys attacking the, specifically the youth market and then building up into, the amateur, collegiate into the pro ranks?
So, we started with an NGO. That's where kind of our foundational basis was. So very familiar with a lot of, the organization structure behind an NGO, what the kind of rules and regulations are and policies and procedures around safe sport and background checks and kind of that high level policy. And that sort of trickles down. And I think a lot of people down at the state levels, at the local and the recreational levels aren't as aware of like technically what lives up here. There's a huge disconnect.
Sure.
So we've kind of tackled the market in terms of like, where do we see some of the greatest need? And I think, again, it's with all the sports that have never had access. We've tackled it from who can afford the services right now, because affording services is a big deal. And anybody who's an operator knows when you go to budget, you only have so much money in that pool to say, I need to pay referees, I need, location and venue, I need parking, I need, liability insurance, I need all the things that you need in order to run that. And a lot of times the medical budget is like this itty bitty line down here and everybody's scrambling for coverage at the last minute. So that's actually kind of been our target a little bit more, is some of these like grassroots organizations. We worked Nike Elite Youth Basketball for the last 2 years. We've covered their Peach Jam, their championship tournament. And they at least have the budget to kind of start to understand. And through that, what we start to do is create the messaging, is like, this can be done a different way. We have a better way to do this to give your athletes the best chance to be performing at every stop on your circuit and to have that continuity and stuff. And so I look at a lot of what we do, and this kind of bleeds in, but like when you talk about all the NIL dollars that are coming in and you talk about athletes as an asset, we talk to organizations about, what does your asset protection plan look like? Because that's what it is, right? This is peace of mind for parents. This is how we're taking care of our athletes and the longevity of their careers, which down the line could affect their earning potential. And so if we kind of switch this mindset of like, oh, I just need to check the box and this minimum standard, and we switch it into, what is my asset protection plan to keep kids engaged in sports, to keep parents feeling comfortable coming back, to say, hey, our organization is operating at this higher level, you should feel good coming to our events, you're going to increase your retention rates. So I would argue that we're kind of stepping at it from that perspective of like, this has got to be part of your whole plan from the start. I
love it. And it's always an afterthought, right? We think about this when the athlete's hurt and then it's too late, right? And so I think it's incredibly important to shine the spotlight on the work you guys are doing. And, quick anecdote, but, we watched Travis Hunter play in a postseason game and took like, I think $100 million insurance policy out on himself, right? And it just starts to show the value of athletes. And as we do commercialize downstream, you're only as valuable as your health, right? Like, we watch so many decisions made based on data, not necessarily performance, of how do we evaluate the lifespan of this athlete, which sort of brings me to my next point, Kelly. We're ingesting so much data from athletes, whether it's an aura, a whoop, we can get sleep metrics, we can get all kinds of different things. How does that incorporate into both like the athlete data profile that you guys are building and then utilizing those modalities modalities to help on the recovery side of things?
Well, I think, there's always room. There's so many wellness apps out there that want to integrate, just even your health app ID on your Apple phone or through your Apple Watch, like that integrates a lot of the stuff. What I want to try to do is integrate, like, what is your straight medical data? What is the rehab data? What is because right now that stuff is really being collected in silos. And one of the things that people don't understand when you look at kind of like injury trends and data is that all of our information on injuries pretty much come from the all claims database, which means that there's not really a record, or it's not being pulled in a central database unless you hit a point where somebody is billing insurance. And so I think what we're not seeing is all of the injuries that never get access to care, or people are paying for on a cash basis that never get reported to that all claims database. So I think that we've got blind spots in our data as to what the injury rates really are. How are we looking at those? How are we keeping people safe and active? I mean, take your adult social leagues.
I was just going to go here.
Yeah, no, your adult social leagues, right? One of the barriers for people to participate is like, what happens if I get hurt? I can't afford to take time off of work to go to the doctor, to go to physical therapy. Oh my God, I have a high deductible plan and my deductible is $6,000. And if I go to the ER, let's kiss 3,000 to 4,000 of that goodbye. The economics of it are really a big factor in people getting care. So what we're aiming to do is break that down and give you really low cost, affordable ways to get access to care, and then follow through with that. And if you need referral to those higher points of care or points of costs of care, then we can do that. But why wouldn't you start with the cheapest option or the most affordable option that gets you the best kind of like idea for your sport specific injury?
I love it. No, it's so neat. And like I said, you beat me to the punch, but we're watching adult rec, and I think that's one of the bigger initiatives is, right, we just want people to move. We want people to stay active. Right. Sports is an ecosystem to promote a healthy lifestyle. But when you have this volatility or this big risk that's on the other side of it, you're having to make decisions not based on what's best for me. It's like you're trying to hedge that and make sure that you're not exposed in a big way. And so solutions like yourself, I think are pivotal in order to continue to promote play, like in the volos and the kickball world, and all of the other pickleball leagues that are picking
I was going to say
everywhere.
The pickleball is and it's not just your 20 and 30-year-olds, right? It's 40, it's 50. Like those Achilles, man, they'll creep up on you all day long.
Yeah.
But it's not even just that. You also look at a population that's moving a lot for work. You look at law enforcement, you look at fire, you look at our military, and they have injuries that happen as well. And all of that gets funneled through workers' comp. If there's ways to keep people healthier at lower points of care or lower costs of care before that ever hits workers' comp, then businesses save money, people get back on the job faster. Athletes is kind of where the bread and butter is, but there's a whole other segment of the population that can be served by stuff like this as well.
I totally agree. And before we dive in on like the business side of this, I'm curious, right? Like in your world, typically this is reactive, right? Like, hey, I've gotten hurt, I need physical therapy. As you guys build out these medical databases, like, do you guys have a proactive approach, or like trying to keep athletes in a position to not get injured as frequently? How do you think about it from more of a proactive lens?
Yeah, I think that there's a lot of stuff that you can do. There's when you look at some of the ACL data, or especially around female athletes, there's jump training programs on, really working on firing the appropriate quad muscles to provide the best stability for when you're doing, jumping activities and cutting. And so there's actually kind of some movements around preventative programs for ACLs. And on the back end, the insurance companies are going, please do this. You know what I mean? We will lower your premiums if you're doing X, Y, or Z preventative things. So I think that there's kind of a push from the insurance companies understanding that this is a high cost for them, and what can they also push. So yeah, I think doing things like that. I think doing proprioception training. I think, putting people on preventative rotator cuff programs for your overhead athletes, your volleyball, your pitchers, any of that, your swimmers is really important. Appropriate core stabilization programs. Everybody that twists and turns doing anything should have really strong core, which is every athlete known to mankind.
Sure.
So yeah, I think that there's absolutely a role for that. And then you can move into the concussion space as well, because there are there's so much kind of knowledge and so much attention on concussions. Like, where's your baseline concussion testing housed? How are we doing that? What if your school doesn't participate? Do I have to go somewhere to do an impact test? Is there other technology out there? There's so many things that are evolving that really can be in this space. And we want to get those out there to the majority of people. Like, the masses should have this. This should not be, reserved for our professional athletes and our collegiate athletes who already have like this great infrastructure to take care of them in place.
Totally agree. And I think as we continue to lower the barrier to entry and educate on services that are out there, this to me, there's so many concussions and injuries that don't go reported or don't get serviced correctly simply because we don't have the right infrastructure around them, right? And that is sport agnostic and it's age agnostic, right? It happens from 6 years old to 60 years old and everything in between. So, Kelly, let's focus in a little bit on your entrepreneurial journey, right? You're coming into a space, and for all intents and purposes, this isn't the sexiest thing to be building in sports, right? But this is the infrastructure that's needed to be able to go ahead and move the ecosystem forward in a positive manner. What has your journey been like educating the NGOs and sort of breaking into the market and selling against something that is perceivably not a profit center, but more of it's a cost center? Like how have you positioned yourself and broke into the space?
So I think probably one of the biggest things for us is joining the Profluence community, in all honesty, because I come from medicine. I didn't come from a business background, but I come from a system building perspective because of what I do in emergency. So the other background is that I'm an emergency physician. I'm also an EMS and a disaster management physician. So I oversee systems of care within our emergency kind of bubble. We are the safety net. And so I know where the holes are in the net, and I know where people continue to fall through the cracks. And so, I didn't know what I didn't know. And so the best way to do that is to just jump in the room with the people who have the knowledge and start to learn and start to figure out, like, what is the business model for facilities that run, and would they benefit from my services, or does that cut into their rent? And so I don't understand how that, needs to work. So my messaging needs to be tweaked in a different way to talk about burnout and lack of, weekend coverage that doesn't affect, your rent. It's just getting in the room and then making people aware. It's just being willing to have a voice and be a thought leader and go, listen, the system's broken. What you don't understand is that our athlete and our active populations are continuing to go up. Your qualified athletic trainers and or like professionals who can take care of this patient population is going down because burnout is a very real thing. If you think about a master's level educated, athletic trainer who has spent years doing this and you're paying them $22 an hour, or I saw a position literally posted the other day, and it was master's required, 5 years of experience for an assistant, collegiate program. And they had those salary listed at $41,000 to $54,000. Who in their right mind is going to work 40 to, let's call a spade, 60 hours a week on afternoons, weekends, mornings, holidays, like those big collegiate tournaments, basketball, that's Christmas, man.
Yep.
Like that's spring break, that's summer. You know what I mean? Like who's working that? We need to change the way that the profession is being done and is being reimbursed and what that business model looks like, so that we can pay people what they're worth and show people their value for the asset protection that they are doing, and still have enough workforce to take care of all the people who need the services.
And for the record, we did not pay Kelly to drop that nugget, but incredibly humbled. And I think this is, when we think about building out frameworks, right? Education and insight to an industry is huge, right? You got to understand what you're actually solving, because you may see similarities and the gaps, but there's a lot of nuances, especially building in sports. And then access isn't just connections, it's relationships. It's understanding, how do I get into the larger, events that are running 15, 200, 2,000 events a year, and really start to understand where those shared services pain points are, right? How do we come in and start to narrow in on that? And it's very humbling, but I also think this is what's needed so that we get the best perspective from outside and bring that into the sporting ecosystem. So, Kelly, as we start to turn the corner, right? What's the promised land of what Elite Seven's building? Like, if you could wave the magic wand and the entrepreneurial journey goes exactly to plan, what does the solution look like at scale?
So the solution at scale looks like athletic trainers are employed by Elite Seven, and every athlete has their own electronic health record that follows them no matter what team or what sport or what city or state or health system you're coming into contact with, so that data belongs to you and you can track what's going on and have full accountability in your health journey. I think it means that every youth sport has, or every tournament or just athletic event in general, has a qualified person on site, on scene, to be able to provide care, and people know where that care is. Because if you've ever gone to a big event and they say, yeah, we have somebody, and you go and you look around and you're like trying to find it on the map, and you're like, I don't know, where is it? Like I was recently at a soccer tournament for my nieces and I was like looking specifically for it. I couldn't find it easily. So if I can't find it easily and I know what I'm looking for, how the heck does anybody else find it?
Yep.
I think that so I think that that's where it goes. And what that does is when you talk about a low cost subscription model, you've lowered the access to care, you've made better use of your healthcare dollars, especially if you can do something like using, health savings accounts and things like that for these types of services, which I think could be on the horizon. That was just a thought that came to me now, but a fairly good one.
Love it.
Don't mind that. But I think that, what it looks like is that everybody knows where the professionals are to get the right help that they need. And you get it when you need it, how you need it, and where you need it. And that means, oh my gosh, I got back from the soccer tournament and, we're at the hotel and we're 3 weeks into this journey. And, we're going from city to city because that's how it rolls, especially during the summer. Do I need to cancel my trip? How do I get my kid in to be seen? Is urgent care the right place? Is the ER the right place? And I'm going to tell you that 99 times out of 10, it's not. It's my own bias from working there. So let me just throw that out there. So wouldn't it be great to hop on a call and go like, hey, this is what's going on. Talk to somebody who's qualified, get you what you need, whether that's peace of mind, whether that's advice, whether that's referral, whether that's like, hey, that sounds like, a second-degree ankle sprain. Let's get you a brace ordered. Let's get it delivered to your hotel. Here's your next steps. Let's check in a week and see how you're doing. Or send me a message and schedule something sooner if we need to address something sooner. You are now accessing healthcare, how you need it and when you need it, at prices that you can afford. And that is what we aim to do.
That's so cool. And it's what's needed. Everything seems so expensive and so out of reach right now. And, if we look at a macro trend, at Profluence, we're aggregating, builders in sports, you're aggregating athletic trainers in sports, right? And we learn that there's both power for a better end product to the athlete with this collective consciousness, and there's power in numbers, right? And so we're now able to defer that cost across many to go ahead and deliver the same value of care, right? And so, we're seeing this trend of aggregation continue to happen. And I think what's so neat is like all parties involved, it creates a win-win-win for everybody, right? The organization, for the athletic trainer, and for the athlete. And I think if we're able to accomplish that, it propels not only a healthier society, but it propels a better athletic journey. I can't tell you.
And a longer one.
Well, and I was just going to say, I can't tell you how many, my wife is a great example. She might kill me for talking about this, but, she was a college softball player and she can barely lift her arm above her shoulder, right? But it's that repetition over and over. And then you're like, it's okay. But now you're in your 30s and that catches up to you, right? So I think there's a lot of those athletes that are listening right now that'll be like, yeah, that's me, right? Like, I wish I had some more hands-on care there.
I had it in college and like, man, I went out and I played pickleball and my back is killing me. Or like, I think can I find a trainer to call? Because that's who my point of contact always was when I was playing.
100%. And then you don't have that when you're out in the real world, right?
Correct. I know. Then we grew up.
Yeah, bummer. So Kelly, before we wrap this up and you sort of drop how to get in touch with you, 2 years into the build, what's been the biggest takeaway that's been a net positive, and what's been the biggest takeaway that's been your biggest learning lesson?
Biggest takeaway. I think that the biggest takeaway is that there is a massive education gap, and our job and the need that we really need to fill is one of education of the public. It's of the builders in sports. It is the education of how to think differently and be willing to take that leap. I think that that's, probably one of the biggest ones. And then what was the second question? This is my ADD brain.
Yeah, no, I think that was the biggest takeaway. And then the biggest learning lesson as you've been building. The biggest learning lesson
is all of the business stuff I didn't know about sports because, again, I come from the medical side. So like I only ever saw one piece. And so I think that the biggest learning points have just been like, how does all of the back end stuff work? What are the business models? What is the revenue generation? If you're an operator, like what are the things that are your biggest pain points? And how can I make sure that I am helping you so that you see, our work together as like a benefit to you? Like I don't ever want to be a burden, but I also think that people have a lot of blind spots in terms of like what their responsibilities are as an operator. I mean, you better know your liability policy inside and out. And that means vetting everybody that is coming into contact with your youth athletes. Like, how is that really being done? Are you relying on somebody else? Like, what happens if there's an incident? Because if you're not on top of that, like your butt's going to be in a lot of trouble. you know?
Totally agree.
So I think that those are a couple of them.
There's so much exposure, and we skirt by these near catastrophic experiences, and we're
Yeah.
like, okay, on to the next one. And it's sometimes we wait too long, right? So I think these measures and companies like you're building are so necessary just for the betterment of the whole ecosystem. So I mean, Kelly, what a fun conversation. Thank you genuinely for the work that you're doing, the perspective that you're
Yeah.
bringing. If anybody listening wants to go ahead and get in touch with you, learn more about Elite 7, implement it into their organization, what's the best way to go ahead and get in touch?
Yeah. So I can be reached at K Morgan, so KMORGAN at e7sportsmedicine.com.
Perfect.
And our website's e7sportsmedicine.com. I want to totally take 30 seconds to kind of put a public health plug in as well. One of the unique things that I get to see sitting, kind of at this this joint space of emergency medicine and EMS and sports and stuff like that is that you look at the catastrophic things that happen in sports, and people didn't die because there were athletic trainers and qualified medical providers there. And I think that we have a really there is some momentum coming with the Damar Hamlin bill that was getting passed about CPR and AED use and stuff like that. I think there's a huge opportunity to really educate the public in general, educate our athletes, educate our coaches, educate our parents on CPR and AEDs and what is that process needed to save a life? Because somebody like me isn't always going to be there, but somebody like you could be there. And if you have that knowledge, you have the power to save a life, and that impacts the public health of everybody. So that's my last sense of a plug.
Drop the mic. If you're not CPR certified, go get certified or reach out to Kelly and figure out a way to do it together. Kelly, this has been an absolute treat. Thank you for all the nuggets, the wisdom, perspective you're bringing into the sports space. For all you listeners, if you like conversations like this and want to get deeper insights, build real relationships with founders like Kelly, be sure to check out Profluent Sports, the centralized hub for everybody building in the sports ecosystem. And until next time, we are out of here. Kelly, thank you again. Talk soon.
Thanks.